Hello, welcome everyone. I am going live today with the medical director of Clínica Tambre in Spain, Madrid, Spain, and we are going to be talking about everything you want to know about male and female fertility testing. So what might you want to do before you go at home, before you go abroad for treatment? If you're not going abroad for treatment, what you need to consider, how the tests are done, what they're looking for, what can be improved, what's important and what perhaps is less important, when you might need certain tests. So Dr. Laura Garcia, who is the medical director of Clínica Tambre, will be explaining about all the initial tests as well as more advanced tests. So if you have any particular questions that you'd like her to answer, please have them ready. She's absolutely fabulous, as are the team there, and she is happy to help. So here we go. I'll invite her in now. Welcome to everyone who's joining. Hi, nice to see you this afternoon. Hopefully, here we go.
Hello.
Hello, good afternoon, Dr. Garcia. How are you?
How are you doing?
Very well, thank you. How are you?
I'm very well, thank you.
Good. Please introduce yourself a little bit more and tell us about Clínica Tambre, for those who don't know, and then we can talk about everything people should consider when it comes to fertility testing.
Great. So I'm Dr. Laura Garcia de Miguel. I'm the medical director at Tambre Fertility Clinics in Madrid. I have experience for reproductive treatments for more than 10 years, and I always love helping people to arrive the dream to have a baby, to create new families.
Yeah.
Clínica Tambre is placed in Madrid, is an international clinic having more than 50% of international patients living abroad, and we are experts in complex cases with implantation failure and repetitive miscarriage. We carried out all type of treatments, including egg donation.
And what I love about your clinic, and when people are thinking about treatment in Spain, which lots of our readers and followers are, you're so advanced when it comes to, well, medicine, but fertility as well. So some of the fertility testing tests that you run are amazing. They're so innovative, and some might be newer than others, but there are a few that I'd love to ask you about today, if that's okay.
Absolutely.
Great. And the team at Clínica Tambre have written for us all about this topic. So if you would like to read more about these specific tests and get in touch with them, please head to our link in bio. I'm going to link this up so that you can read everything you need to know and also contact them. The first thing I wanted to ask you is, what initial tests do you ask your patients to do when they come to see you?
So we always ask for a general spermogram.
Yep.
And we also ask for ovarian reserve testing, including antral follicle count testing and including anti-Mullerian hormone. Also, we include pelvic ultrasound examination to check uterus and endometrium, and also smear tests, mammography, so general gynecological testing.
And is that the same as UK tests? Is that what UK clinics would ask for, or do you ask for more advanced tests?
Correct. So that's the initial, and then there is a part of the test which is Cardiotype testing that usually UK patients, they can also do it there, but not all the clinics ask them to do it, which is a blood test to confirm if they have normal chromosomes or if by contrast they have any translocation that can lead to more abnormalities in their eggs or in their sperm. And we ask before going ahead with IVF to do this blood test here in Madrid or in the UK.
Is that for every patient you see, or is that just for people where you feel that they may need it due to medical history or whatever might be the circumstance?
We normally recommend for everybody going ahead for IVF, and if they are going IVF with egg donation, so we will only ask for the male partner. By contrast, not for the female, as long as we will ask this Cardiotype testing for the donor.
Okay. Okay, that makes sense. We've had some questions come in, so I'd love for you to answer those in a minute, if that's okay. We'll just have some questions to ask you first. And if other people have questions, feel free to drop them in the chat box and we can get to them. So, essential tests, you mentioned STIs. What else for women? AMH. Would you have people have a scan as well?
Correct. So we always do this pelvic examination with to see the uterus, the lining, to exclude fibroids, to exclude cysts, polyps. Also the antemolurant to check the ovarian reserve, the quantity of eggs that they still have. And also we always need to ask for serologist blood tests for both part of the couple, or if it's two women doing the IVF, because we need to exclude patients having, for instance, HIV in the normal procedure, but of course we can accept even if they have problems with HIV or hepatitis B, whatever.
Mm-hmm. What I love about your clinic as well is the fact that you are so inclusive to any kind of family building scenario. So we've had lots of readers who have come to you, or we've introduced them to you, who are looking to become parents solo or same sex, for example. Lots of lesbian couples who are looking to pursue becoming parents through you as well. And so obviously testing, I presume, will depend on the scenario and whether donor eggs or sperm are needed or being used as well.
Yeah, so for us the most important is to help everybody. So of course it's only for the treatments that are accepted in Spain, which is the majority, except as surrogacy, but the rest we can do everything, and we are happy to help everybody, no matter the marital condition, the sexual orientation. And of course for us the most important is to help in what you said, to find all medication, to do the treatment they want to do it, to help in all this patient journey.
Yeah.
So for instance, for patients living in the UK or other countries, we normally ask them where they prefer to buy medication, if here in Madrid when they come for a first consultation to meet us, or if they prefer to buy it there. So we put in contact with specific pharmacies, online companies, so they can even give the medication at their house.
Yeah.
And always the coordinator, the patient care department, will help them to find this medication, or to find the place where they need to do the ultrasound, whatever it's important to do it locally in their countries.
Mm-hmm. And that support is vital. I know you offer a lot of support. What I also think is a lovely thing that you offer to your patients who come abroad is the fact that you pick them up from the airport and bring them to the clinic, which I think is a very nice personal touch, especially when people are feeling kind of apprehensive. And I had treatment not in Spain but abroad, and so I know that it can be nerve-wracking thinking about what medication you might need, what testing you need to do beforehand, what you do when you get to the clinic. And so giving people that hand-holding people through those steps is just invaluable.
Yeah, it's really the most important aspect. Of course, it's not only technology, success rates. We know infertility, it's a major stress in all humans. So we are here to support them, to help them, and especially for people that it's not living in Madrid, it could be a big challenge to go for this treatment. And we try to reduce anxiety, to support them, to guide them, and at least to make them feel we're here, and we can help 24 hours, 7 days a week.
Mm-hmm. Fantastic. So AMH testing, and that's something that lots of women may be familiar about, and I know that's an early test. How much can we tell about egg reserve from that test?
Yeah, so it's a very interesting question, because in the beginning we used to consider AMH like a super test, and of course it is, but we need always to integrate all parameters which is not only AMH but also the antral follicle count.
Yes.
So what does it mean? It means that I have patients with a very high AMH, and by contrast, they don't respond very good to medication, and they don't have a very good, recovery the day of the egg retrieval. Whereas I have patients that we expect not to have a super good response because of the AMH, and then the response is excellent. So it is a good parameter to have, at least a realistic expectation, but then it's not mathematics. So it's not only, what is your anti-mullerian hormone, then it's absolutely clear the medication and dosage we need to select and the number of eggs that we will retrieve. And by contrast, we need to integrate everything, including the body mass index, including the age of the women, and then just see how it works and just support if there is not a very good cycle in terms of response, just recommend what is the best treatment in a second cycle. Just explain the possibilities to come even if there is only 1, 2, 3 follicles, or option to cancel and move the egg retrieval in another month.
And from the fertility testing that you do, whether it's in advance of people coming to you or in your clinic, does that determine what kind of medication and the route you're going to take for the treatment based on the tests?
Yeah, so normally the medication will be selected depending on the anti-Mullerian hormone, antral follicle count, the age, and the previous IVF. Okay, so it's not really like a super big quantity of hormones we can use. It's good that we not only have one protocol and we can select different medications, but at the end of the day, it's quite easy to select from this first consultation and the first interview with patients what is the protocol. So in this first consultation, we will give the protocol that of course will be confirmed in 2-3 weeks in the online consultation, but we will have an idea how the protocol will be and the dosage and treatment plan.
Brilliant. And if people get the testing results, such as their AMH results, I remember when I got mine, I had already Googled what was the sort of normal range that I was looking for. And so even though I think my range was kind of in the range it should be, I still felt it was lower than I wanted it to be. And that worried me before I'd even gone out to start treatment. So do you see a lot of patients who have analyzed their own results?
Absolutely.
Feel the concern before they've started?
You have described exactly how it is, okay? So it's a big pressure when you know that because of the age, perhaps you are not like in the best, group of success rate, and also you see the anti-Mullerian hormone and it's not super good. So I always try to, relax my patients and just say, it's not how we start, it's how we conclude the treatment. And there are patients with a super good ovarian reserve, but then the quality it's not satisfactory and I don't have good blastocysts to transfer. Whereas, with all these years of experience, I've had a lot of patients with low ovarian reserve and with a very good quality and a good arrival of blastocysts. So I always try to be optimistic, just explain the realistic situation so that we don't have like false hopes and high expectations, but just say we just need to work step by step. Don't be like in a pressure that what is your anti-Mullerian hormone, because it's only one parameter.
Yes, exactly. And if people have a low AMH, is there anything that they can do to improve it?
Unfortunately, this is biology, and this is like the deposit of eggs that we have, and there's nothing really that we can offer. What I always try to let them know is that we can retest in another month if they feel very bad, just to confirm. And then it's very important, especially in low ovarian reserve, to select the best moment to start with IVF, and not to start whatever month, but to start with a good number of antral follicle count, that of course it's variable from one month to another.
Absolutely. Now, men. Obviously, you must see this a lot, and I hear this a lot in the community that some, heterosexual couples may start investigating the woman for a long time before they realise there's a problem with the sperm. Um, I was quite lucky, well, sort of, in that we found out my husband has no sperm early on. Before we had done anything else, we did initial testing, and that's when we both found out our sort of fertility health. Um, you offer very advanced testing, don't you, at Tambray? So please can you tell us a bit more about sperm DNA fragmentation and the tests that men have?
Correct. So I completely agree with what you said. We're always focusing. I talk about gynecologists. We always focus on women, age, ovarian reserve, quality of eggs, quality of embryos. But sometimes we don't offer our best in the sperm aspects. So when we have this first consultation, we always to recommend sperm sample with 3 days abstinence, and we give the opportunity to confirm about general parameters that that also there is a big variability from one sample to another, and in that sample we freeze and we do the fragmentation. The fragmentation is a quality testing in the head of the spermatozoa where we want to confirm the DNA fragmentation. What is that? This is the head of the spermatozoa is containing the genetic material, the DNA in single brain and also in double brain. What we want to say, if these brains have interruptions or fragmented due to smoking, due to alcohol, coffee, tea, chocolate, varicocele, whatever, and if there's something that we can do to improve the fertilization of the eggs of the female or the egg donation or the egg donor, also the arrival of blastocysts and the internal genetics of the sperm in order to improve, to have more embryos.
Mm-hmm. Yeah.
And that's something that it's quite advanced, because it's not all clinics doing this. We have a lot of patients that they say, yes, I've done multiple fragmentation tests in my country, but it's not the double brain fragmentation, it's only the single brain. And the single brain fragmentation, it is always reduced with ICSI procedure. So the main advantage for us COMET test, it's the double fragmentation. If it is high, we recommend patients to take turmeric for a cycle of 2-3 months, which is the time the cycle to create new sperm. It takes 90 days. And then we offer, if they want to come and do another fresh sample the day of the egg retrieval, in order to do the technique specific for the reduction of fragmentation, which is called chip fertile.
Mm-hmm. Okay. Yeah, I saw that. And also FISH, fish? What's that for?
Yes, this is a genetic testing that we also offer in the sperm, and it is to see if genetically these spermatozoa have problems in the chromosomes and then are more at risk to create embryos, aneuploid embryos, so abnormal genetically speaking, or if by contrast everything is okay.
Okay. More advanced female testing, if you have time to go through this. We have ERA and Emma and Alice, and I always find those terminologies quite endearing, really, to have pretty names associated to them. But what is an Emma test and an Alice test, for example?
Yeah, so Emma test, it's a biopsy that we carried out in the midstream, and it's to confirm if regarding microbiome everything is normal. So the environment of the normal bacteria that protects against other infections are good in terms of the lactobacillus, or if by contrast it's not good and we need to take probiotics to maximize this environment for the implantation. And the Alice, it's also a biopsy to test if we have infections, if we have endometritis, and what is the exact bacteria that is doing this infection and what is the specific treatment that we need to recommend that lady.
So when would the advanced testing happen?
So we recommend for all patients with at least 2 blastocysts that have not implanted or they've done miscarriage, EMMA-ALIS, and for non-implantation also ERA testing.
Okay.
But of course we have patients, they say, even I don't have any failure, I want to maximize my first attempt because I don't want to come from, you know, from the UK, and then in case I fail, then you will ask all this. So I'm always very honest. I just say, okay, because of the, you know, what the medical literature recommends, we will try at least 2 transfers without this advanced testing. But in case they don't want to do and they want to maximize opportunity from the first, we can do everything from the beginning.
Okay. And what exactly is an endometrial scratch? Is that similar to everything else that you've been describing?
So this is a procedure that for very specific immunological profiles, depending on, you know, what case in particular, this is the benefit of the impact of the damage of doing a biopsy to improve the next embryo transfer the next month. So the medical evidence, it's not clear at this point, it's not 100%, but of course, with very complex cases, if necessary, we offer that.
Okay. And I know that I was one of these patients, but for implantation, do you find that people want to have it, you know, tests done to check their receptivity before they have transfers, or is that not something that you would look at after a couple of failed cycles or a failed cycle, for example?
Yeah, so again, we are very honest. We explain all the possible tests that they can do in a first consultation. So normally when we have like a first contact in an online consultation, before they come to Madrid in a first consultation, I always explain this is a possibility if you want to come and, you know, before you come, you do all the medical preparation treatment in order to do the biopsy for ERA or EMMA or ALIS. So then they already know this and they don't need to come back in another moment.
Okay, that's good to know. Thank you. Do you have time for a couple of questions?
Absolutely.
So someone has just privately messaged saying they are CMV negative. They're looking for a donor and they've been advised to use a donor who is also CMV negative. I remember having this thing myself. Do you advise that people should go with someone who is CMV negative if they are, or does it not matter so much?
It does not really matter so much. So regarding our, Spanish law commitment, it's not obligatory to do cytomegalovirus in our donors. By contrast, we always test our donors for that, but it's not necessary to always do negative cytomegalovirus for negative cytomegalovirus recipients. The most important is to exclude active infection for cytomegalovirus, even in donors, but especially in recipients before the transfer.
Mm-hmm. And also, it's really hard when you've matched with a donor or you've selected a donor to then have to start the process again. So yeah, it's reassuring to hear that. Someone has said, I'm having EMMA, ERA, and ALIS testing. I've had 2 failed double donor cycles. Are there any other tests that she could consider?
Yeah, we always recommend, apart from this, doing a study of the cavity of the uterus with a 3D scan or with a hysteroscopy to make sure there is not a septum, there is not, a malformation, and also to exclude if there is adenomyosis or not. Mm-hmm. Because adenomyosis, which is endometrium in the walls of the uterus, in the myometrium, should be a possible cause for implantation failure, and then we need to prepare the uterus with a different protocol than the general one.
Okay.
And also we recommend doing coagulation and immunological testing including thrombophilia, including antibodies against thyroid, including the study of celiac disease, KIR, HLA. So it's a very complex blood test list, which is not easy to find a laboratory abroad to do. So sometimes patients, they decide to come directly to do all this implantation failure testing here before going ahead with the next transfer.
Okay, that's good to hear. Someone has said that they moved to egg donation. They visited your clinic in January. They've decided to go with you. How can they buy medication in the UK rather than in Madrid?
So they can buy here and fly back home with all the medication, or they can buy in their countries, and we always contact with some pharmacies that normally they work online, and they ask prescriptions, ask medication, and they buy it from the internet, and they will have the medication at home very soon.
Okay, that's good to hear. And also, how long is the wait for a donor?
Normally it takes around 2 months maximum, so it's variable depending on, you know, the characteristic of each recipient, but normally no more than 2 months.
That's pretty good. Great, thank you. When would you do a FISH, an FISH?
So the FISH in the sperm is also recommended when we have like difficult cases such as previous egg donation failures, or IVF with previous rounds that have failed, just to see if it is necessary to go ahead with PGTA or not in the next attempts, in the next cycles.
Speaking of which, does testing have any harm on an embryo, if someone has asked? And we get that question a lot, I'm sure you do.
So it's a complex case that we can, you know, talk for more than one day, and you know, we have authors that they really rely on this biopsy, and they say it's not a big damage for the embryo, whereas others, they strongly do not recommend. So I always say this is a more invasive procedure in the lab, but if we do with the experts' hands here in our clinic, it should be okay. This is a benefit because we will know internally the genetics of that embryo in particular, but it's a little bit more risky in terms of that embryo can, you know, reduce the metabolism and can reduce the success of survival. So we really need to decide in particular for every single case if it's worth it or not. I would say definitely if we have more, you know, lots of embryos, yes, but if we only have one embryo, then no.
Okay, that's very interesting to hear. Thank you so much for answering all of those questions and for your time today. If anyone has any further questions for the team at Clínica Tambre, please DM them, or you can message us and we would be happy to put you in touch. Wonderful, wonderful clinic in Madrid, Spain. Very advanced, as we've just been saying. And also, please head to our link in bio to read more about the testing for men and women that's offered through their clinic, and what you should be really looking for and when. So thank you very much.
Thank you so much. Have a lovely evening, and hope to contact again very soon with you.
Definitely. Thanks everyone for joining. Have a nice evening. Bye-bye. Bye.
Bye-bye.